the same time horizon around April 1st, when we had 956 cases documented in Santa Clara County, we realized that the number of infected people is somewhere between 50 and 85 times more compared to what we thought, compared to what had been documented. Immediately, that means that the infection fatality rate, the chance of dying, the probability of dying if you are infected, diminishes by 50 to 85 fold, because the denominator in the calculation becomes 50 to 85 fold bigger. If you take these numbers into account, they suggest that the infection fatality rate for this new coronavirus is likely to be in the same ballpark as seasonal influenza.
Hi everyone, this is Global Government News. It's Tuesday, April 28th, 2020, and this was an interview with Stanford University's Dr. John Ioannidis, who said basically that COVID-19 isn't as deadly as previously thought and it's similar to the flu. But according to the findings, like he said, the infection fatality rate for this COVID-19 is significantly lower than previously assumed. This is another article just covering the actual research that they did in Santa Clara, California. So some people may wonder, why is this important? It says, assuming that their findings are confirmed, among the important public health benefits would be a quicker end to the pandemic lockdown that we are all experiencing. And this is relevant because the WHO, the World Health Organization, warned on Saturday that there is still no evidence that people who test positive for this new coronavirus and recover are immunized and protected against being reinfected. It says here it's pretty clear why they're saying this. They're a major advocate of mass vaccination programs, and they want to use this pandemic hoax to vaccinate as many people as possible with whatever mystery vaccine they promote to the public, which from what I've been reading lately could actually have a freaking microchip in there to track people, among other things. If they say that people who recover are immune from the coronavirus, those people won't need to get a vaccine, also to sell the vaccine and make a lot of money. And then just yesterday, the world should have listened to us, to the WHO, on the virus. They said not all countries heeded its advice that is as bad as what it was, and it's turning out that it wasn't. But he's still going out there saying that, you need to take a vaccine if you want to end the lockdown. Also, he's saying that the pandemic is far from over, and he's worried about the children. I'm sure he is. We better get those children vaccinated as well. So there you go. The coronavirus pandemic is far from over and disrupting normal health services, especially life-saving immunizations for children in poorest countries. Yesterday, I showed you a quote from Bill Gates and how he felt he was saving millions and billions of lives, while at the same time people were actually dying because of all of these lockdown measures and restrictions. People who wouldn't have access to healthcare and surgeries, like these cancer surgeries, organ transplants. And if you're not totally anti-vaccine and you believe that some vaccines can be beneficial, you have regular vaccines such as for polio, measles, cholera, yellow fever, meningitis, where there's a shortage and disruptions because of the coronavirus pandemic and restrictions, border restrictions and that. So this article says it's high time the CDC get its act together and conduct these antibody screenings and tests. But they don't really want that. They want to drag this out so they can continue this lockdown as long as possible. Here's a video coming from California of two doctors who run their own private clinic who've been doing screenings. It's been floating around the internet lately. I was pretty shocked. It was refreshing to hear. The data is showing us that it's time to lift the lockdown. So there's been new tests from not just Stanford University, like we just mentioned, but USC and the county of LA show the death rate is much lower than previously predicted and comparable to two seasonal flu strains. As I'll get into in this video, many hospitals are artificially inflating COVID-19 deaths. So these two doctors here, they're not just nobodies. They're former emergency room physicians. They're out of Bakersfield. They run their own testing. They've done 5,000 tests to date, and they said that based on the latest data, the lockdown was not justified and should be immediately lifted. In the video, they actually mentioned that 95%, from what they're seeing, 95% of the people who are infected and that get sick are fine and recover. The other 5% that die, 90% of those are people with pre-existing condition, usually elderly people. He's seeing millions of cases with small amounts of death. For example, he says even New York has a 0.1% death rate and a 92% recovery rate. He said it's not statistically significant whether you lock down or not. In yesterday's video, I mentioned different places like Wisconsin, Minnesota, Colorado, where people were protesting against the lockdown to end the restrictions. This is also in Europe, the Polish-German border. Let me go to work. Hundreds of protesters demand removal of fence. One of the mayors said that many people have lost their jobs because of this. I guess they regularly travel and commute to Germany from Poland to go to work, but also they've been separated from their families as well. In that video with the two doctors from California, they made a bunch of good comments. It's surprising they weren't just talking about the statistics not being right and stuff, but they were against this lockdown. They said we need to put measures in place so economic shutdowns like this do not happen again. It's not just economic, but social. We want to make sure that we understand that quarantining the sick is what we do, not quarantining the healthy. So yeah, that's what's so weird about this whole thing, is like everybody's being quarantined for like less than 1% of the population who are vulnerable. And then you see these sick, disgusting signs everywhere saying hashtag we're all in this together. And like I didn't get to mention yesterday in that article with the Colorado protests was all of these nurses who have nothing better to do because they actually have empty hospital beds and stuff and no patients. They have nothing better to do to go out and disrupt these protesters who are demonstrating peacefully, just saying please end the lockdown, we need to go back to work. And these people, these nurses and that, I guess the next day were complaining that they were saying bad things to them, these protesters, and it hurt their feelings. But basically they feel like they're authoritarian. They have the authority, they like the power that they have, and all of these signs that I've seen, billboards and that, calling them heroes. I'm not bashing nurses, I'm just saying how they're propping them up. And then God forbid people go out and protest and say, hey, we want to get back to our normal lives. And then nurses say, no, we're going to continue our job, we're going to get paid, we're going to be called heroes, but you guys can't. It's not safe. You have a Yale doctor saying on the 25th of April, U.S. should have lockdown for as long as possible amid coronavirus. He points to South Korea as a great example. They receive praise from around the world of their handling of it. To flatten the curve, they use contact tracing to figure out where people who tested positive have gone and interacted with. And they are also using GPS phone tracking, surveillance, camera records, and real-time alerts for where affected people have began. He says that we should do this 7-week lockdown thing. If we don't, and we have to go through this 7 or 10-week lockdown and then do it again in 3 or 4 months, we have a disaster on our hands. But from everything I'm seeing, they want to continue this, and they want to have another one in the fall, another lockdown, another one in the spring. Waves of it. You even have Fauci saying we're going to have coronavirus in the fall. So if it's going to be here, then why shut everything down? This is what I'm talking about. Germany opens some shops as Merkel warns of second waves of coronavirus, cautions against lifting lockdown too quickly, saying infections could spike. Then I saw this article from Iran witnessing declining trend in deaths. I scrolled down and I saw this. I would like to emphasize that at a time when smart and gradual social distancing takes place, any violation can have serious and irreparable consequences. He also predicted that there would be 2 to 3 outbreaks over the next year, and basically have to hold out until they get their vaccine. And Merkel said the same thing as that Yale health department guy. It would be a crying shame if the country, which had been praised for its handling of the crisis, fell into a relapse. Italian Prime Minister vows to gradually lift lockdown throughout May, but some restrictions will remain. We cannot continue beyond this lockdown. We risk damaging the country's socio-economic fabric too much. Many Italians are most concerned about when they will be able to walk in the park and jog without being stopped and harassed and fined by police. Many have turned their roofs into gyms and improvised tennis courts in order to avoid going stir-crazy. Says we're not in a position to restore full freedom of movement, but we are studying a relaxation of the current strict regime. We will make sure to allow greater freedom of movement while being able to avoid the same thing that they keep saying. So they're doing this in a incremental way, testing the public, gauging them. I saw something with Cuomo saying something about, yeah, you can't keep people locked up all summer. So they know what they're doing, and they know that people will start cracking, and they know that the economy can only handle so much of this shutdown before it really starts to implode. Like I said, this 3-phase opening of the economy, keeps the opening of the economy. Fuck the economy. The society is the most important thing. People's mental health, their well-being is more important than just corporate profits. But yes, the economy, being able to go to work, for some people would be really nice. But when they start to complete this 3-phase thing, which will probably take like 6 months, like September, like I said, the regular seasonal flu is going to come up, and then they're just going to clamp down again. So regardless of what happens, they're going to clamp things down again. And they'll justify it by saying that we ended the lockdown too soon. You'll hear that, oh, we should have kept everything locked down, contained for a longer period of time. Damn it. This is there's something that I didn't get to in this article about the Rockefeller Foundation paper published in 2010 that I wanted to get to. This is the stage or the title, Lockstep, that you keep hearing. It says, during the pandemic, national leaders around the world flexed their authority and imposed airtight rules and restrictions, from mandatory wearing of face masks to body temperature checks at the entries to communal spaces like train stations and supermarkets, even after the pandemic faded. This more authoritarian control and oversight of citizens and their activities stuck and even intensified in order to protect themselves from the spread of increasingly global problems, from pandemics and transnational terrorism to environmental crises and rising poverty. Leaders around the world took a firmer grip on power. This was written in 2010. Antibody study shows COVID-19 is already widespread and death toll much lower than we were told. It says 28 to 50 times higher than the cases that were reported in early April. This was the LA County Department USC one that we were talking about. The point is to look at it this way. We destroy the economy and people's lives for something that is turning out to be no worse than the common cold, and the same people, these authoritarian figures, are still pushing this as if it was as bad as they said it was. You know, how could they have credibility at this time? How could Bill Gates still be out on television saying what he's saying? Italian study found that most who died from the coronavirus actually had pre-existing conditions. 99% of them. The average age of the people that died was 79 years old. 1 in 3 death certificates were wrong before the coronavirus. The problem is likely to get worse, they say, as the pandemic inundates overworked and sometimes untrained officials. Well, it's not that. They're telling them to do that. Change to death certificates could boost COVID-19 counts. Talking about respiratory problems with people who died with COVID-19, he said we wouldn't necessarily count it in our data points because it's not confirmed, but things have changed. They said that those who fill out death certificates can categorize pneumonia deaths that can't be traced to another condition as presumably or presumptively COVID-19. March 24, 2020, the National Vital Statistics System, these are the people who create the policy for how they categorize these death certificates. Should COVID-19 be reported on death certificates only with a confirmed test? It says COVID-19 should be reported on death certificates for all of those, I guess that means deceased, where the disease caused or is assumed to have caused or contributed to death. So the underlying cause depends on what and where the conditions were that were reported on the death certificate. However, the rules for coding the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not. In March, U.S. deaths from COVID-19 totaled less than 2% of all deaths. According to official data, this rampaging plague is mercilessly slaughtering an immense 0.0001% of the world's population every day. And here's the heroes in the hospitals. I mean, war zones. This is a war, right? With a common enemy. CDC adds 6 new symptoms to the official coronavirus symptom list, which will bump up the numbers even more, besides fudging the death certificates. Then you have the hospitals are overwhelmed hoax. Seattle hospitals brace for a wave of COVID-19 patients. America's hospitals have never experienced anything like this before. But what? I'm seeing empty hospital parking lots. That's right. The field hospital in Washington will be dismantled without a single patient. Doctors are still waiting for the feared surge of COVID-19 patients, and just 8% of medical workers who volunteered have been assigned a job. Thank you.